Since everybody have their headphones, the first question goes to Zhenya in Russian. For him, will be easy to answer. Zhenya,
very good presentation. Thank you very much. I have a question. We know that Russia plays an important role in Eastern Europe and Central Asia, and many migrants are infected in Russia and then they travel back home to their countries. And CDC data shows that more than 50% of new HIV infections are between different groups of people traveling to Russia. So to what extent do you coordinate the advocacy work with the structures in Russia? Do you cooperate with different agencies in Russia, be they domestic or international? Do you cooperate with WHO in Russia? And do you use those international organizations in your advocacy work? How do you engage them when you talk about the problems of key populations, and how do you engage them when talking to different communities, like MSM communities and also migrant communities in Russia? I do hope that due to the World Health Organization, by the end of this year or in the beginning of the next year, we will convene a meeting that shall be devoted to the promotion of PrEP and HIV testing. However, it is very difficult to say anything about advocacy and any support given in advocacy by the Russian authorities, state authorities. I cannot give you any specific answer. They are all too chaotic. There is no dialogue. I do not see any dialogue between the NGOs and the state authorities, or the Ministry of Health for that matter.
And as you mentioned, because I know the ECDC collecting the data from the official sources, right? Through the Minister of Health, from each country.
Well, except for Russia, I think that data comes from the AIDS Center because there's a disagreement between the data from the ministry and the federal office.
I'm more worried about Central Asia.
Yeah.
In terms of the data, we didn't see, we saw just really some data about the Central Asia, but in every single slide mentioned Eastern Europe, Central Asia, and there's no data. What is the reason then?
So which data are you thinking specifically?
Regarding everything, and HIV data, and with the groups, and all. Because you mentioned about Central Asia in every your slides, yeah, but we didn't see the data. It was only Kyrgyzstan. You don't have any data from Kazakhstan, Tajikistan, Uzbekistan, Turkmenistan. What is the reason?
Well, so for example, for PrEP, if you're talking about the PrEP slides, we do have data, but they're not implementing it. So the official response from the ministry is that we're not implementing PrEP. It's not part of our program. So we report that not as not having data, but actually not implementing PrEP whatsoever, if that's the data you're talking about.
Okay,
when it comes to the surveillance data, we do have the data, but I showed aggregated data for the regions.
Then goes another question, then how you're using in terms of the advocacy, the collected data to promote access to PrEP at the country level. Are you presenting through some agencies? Because I'm pretty sure at the country level, they don't have any idea about the, I mean, I know they are collecting, they're providing your data, but how you are actually presenting, and are you involving the civil society organization and the patient and the community organization during that process, that they can use your data during their advocacy work?
Yeah, I think we can be much better at that. We are trying to tailor our outputs to different audiences. So we're producing these short evidence briefs to policymakers and civil society NGOs. We're producing this scientific manuscript to academics. We're producing bigger reports to public health people. So this is a challenge that we have in trying to reach out with the evidence that we have. But this paper that we published yesterday on the PrEP gap, Valerie and myself and our co-authors, which included all the people that supply data to us, actually the ministry people, we really did that report for advocacy purposes. So now for the first time, we have country-specific data on the gap, the PrEP gap in Europe, and I think that's a fantastic tool for advocacy that NGOs could use.
Thank you very much. And the third question, sorry, I forgot your name, with the cost-effectiveness analysis. David, yes, thank you. Yeah, David. The question, how did you include the different ages when you assessed the access to the PrEP? And did you compare college to Dalis? disability-adjusted life experience. Thank you.
We did not include age into it, so it was a general model. So we took like the entire Dutch MSM population and the entire German population. We chose to do QALYs, but there's always a discussion, should you use QALYs or DALYs? But QALYs in general are more accepted in Western Europe, that's why.
Because we are talking about the AIDS as well, right? You mentioned that there is many cases which AIDS, which is already related to DALYs. That was my question. Did you make a compare between QALYs and DALYs?
There is indeed, unfortunately, there's still people being diagnosed in the Netherlands and in Germany with AIDS, but the numbers are fortunately also low. So, but the main reason to take QALYs was actually because this is more the standard that we use in the Netherlands and in Germany.
Okay, thank you. As I see, we have 3 persons who would like to ask. So, can you please short, because we have very short time.
Thank you. I want to thank 3 of you for very informative presentations, and I have a short question to Teymur. First of all, do ECDC knows in which locations the majority of so-called informal PrEP users live? And the second question will be to Evgeny. I'll speak this question in Russian, just to save time.
Zhenya, how many PrEP users are there in Russia today who receive PrEP from medical providers and through the internet? So what is the general number of PrEP users today in Russia, and what is the trend? Do you think that the number of PrEP users is going to increase or decrease in Russia?
So just answer quickly on if we know the location of the people who are using informal PrEP. ECDC does not know that data. We don't have that data.
We know that approximately 100 people receive PrEP in a commercial clinic in Moscow. And I spoke with one of the manufacturers. This is a manufacturer of generics. And the manufacturer says that they say approximately 500 people buy 2 different drugs. Tenofovir and entrecabine is being purchased, but most probably those are the people who are already are taken into consideration in our research. So it's 500 people at most. I have a very brief question to Evgeny. Although Evgeny already spoke about it partially, you said that they buy PrEP at a commercial clinic in Moscow. But how about your legal basis? Do you have any legal regulations with regard to the PrEP? So legally wise, how is it arranged today? And how does a commercial clinic work with PrEP? What is the legal basis? To the best of my understanding, they are in the gray zone. We do not have medical guidelines for PrEP in Russia, although recently there was that meeting of infection specialists, and they did approve guidelines. Those guidelines have not been published yet, so it's not a document yet. And to the best of my understanding, the Ministry of Health has to somehow approve it formally. Once that is done, we will have a document which may be used by physicians to prescribe PrEP. So the situation is, we run a website, and we have this button. You click the button, which says "Receive PrEP," but there is no information. It simply says that one may address a federal AIDS center and speak to a specific physician. I spoke to Mr. Bakrovsky, is the physician whom I spoke to, and he said that yes, it is possible. So people may address him at the federal AIDS center and receive consultations only, and then the physician may prescribe PrEP. And I have addressed all major AIDS centers, and they all just the same thing. No, we cannot prescribe PrEP. Yes, they may come and talk to us, we may consult them, but we cannot give them any specific information. So people, they address the website, they receive some preliminary information about PrEP, but there is no one to address, no center to address to receive PrEP. So I understand that commercial clinic are doing that at their own risk, because it is not a regulated industry yet. No, it isn't. They do it at their own risk.
Fantastic question. Thank you especially for the speakers. It was very interesting. And I thank you for that we were on time. We have 20 minutes break, and please be on time here. Thank you for your attention.